and welcome to Path Made Easy. Today's example is a nasolabial cyst. Now, a nasolabial cyst is a non-odontogenic developmental cyst, and as the name suggests, it tends to occur in the nasolabial region. So that's in the upper lip, lateral to the midline. These cysts occur within the soft tissue of the lip, so you would not expect to see any changes on an X-ray of the alveolar bone, apart from possibly some pressure suturization. So this particular cyst is mainly diagnosed on its precise anatomical location. It tends to be asymptomatic, sometimes causes a bit of swelling in the region, but they're easily cured with local excision. So a nasolabial cyst, like many other types of cyst, has three component parts. So it has a lumen, an epithelial lining, and a fibrous connective tissue wall. Now, the lining of a nasolabial cyst isn't particularly specific, but it tends to have respiratory epithelium, sometimes some squamous epithelium, and then maybe some epithelium somewhere in between. So if we look at this epithelium here, it's reminiscent of respiratory type epithelium with this kind of pseudo-stratified epithelium, and we can see one or two mucus cells, and perhaps with the eye of faith there are some cilia as well. If we compare it to the other side of the cyst, we've got a much simpler, almost stratified squamous type epithelium, and obviously there's no keratin or mucus cells on that. So this lining is quite convoluted and folded, but generally as we move along, we're basically seeing this simple type of epithelium, or areas like this, which look like respiratory epithelium. This is a developmental cyst, so within the cyst wall you wouldn't expect to see much inflammation. There are a few areas where we've got plasma cells congregating, and sometimes you'll see that if the lesion is being traumatized. But this is a nasolabial cyst. It's fairly straightforward to diagnose. And if you enjoyed this video, please don't forget to like and subscribe to our channel, Path Made Easy. Thank you.